the time. Today we will be seeing about body fluids and in that particularly about cerebrospinal fluid. Let me share the PPT. Cerebrospinal fluid we will be seeing today. So body fluids are considered to be interstitial fluid, saliva, tears, amniotic fluid, gastric juice, etc., which are used for moisturizing the tissues, muscles, organs, skin, etc. 60% of human body fluid is made up of water, then solutions of ions and other substances, and body fluids can be divided into particularly two, the intracellular fluid and the extracellular fluid. So in that one, since we'll be seeing about CSF or cerebrospinal fluid. And cerebrospinal fluid is a clear, colorless body fluid that surrounds the brain and spinal cord. It provides cushioning and support to the central nervous system, helps to protect the structures from injury. The formation is by the choroid plexus, and it's a network of blood vessels in each ventricles of the brain, and it is formed by filtration of blood plasma through the capillaries of this choroid plexus. Epidermal cells line the choroid plexus and they modify the filtrate so that this CSF is not identical to blood plasma. And almost 500 ml per day is produced in every human adult. The circulation of CSF begins in lateral ventricles down through the interventricular foramina into the third ventricle and then through the cerebral epiduct into the fourth ventricle. The CSF passes through three openings, like central foramen, the two lateral foramina. So then they pass through the subarachnoid space around the brain and the spinal cord. The absorption in the venous system by is when it passes through the arachnoid villi into the sagittal sinus and other dural sinuses. The cellular composition of this CSF is the erythrocytes. Normally, there should not be any erythrocytes there. It's like an abnormal condition if erythrocyte is present. Leukocytes, a small number of WBC, less than 5 cells per microliter, are normally seen. Mostly the lymphocytes and monocytes, and small number of neutrophils and eosinophils are totally absent. Other cells like ciliate epidermal cells, which is a lining of the ventricles present, indicate disruption of the blood-brain barrier ventricular system, and epithelial cells present in the small number, and oligodendrocytes and neuro also can be present in case of certain pathological situations. The biochemical constituents of CSF is like protein is almost 15 to 45 mg per deciliter, in which the albumins, alpha, beta, and gamma globulins can be seen. Then IgG, it is a major immunoglobulin, and this its origin is from the serum actually. And glucose almost 50 to 80 milligram per deciliter, and reduced glucose levels in bacterial and fungal infection can also be seen. Then lactate less than 2.1 millimole per liter, chloride almost 180 to 132 millimole per liter are seen in the normal cases. At infections, albumin globulin ratio can change also. And enzyme lactic dehydrogenase, alkaline phosphatase, elevated levels of this can be a signal of the disruption of the blood-brain barrier. Bilirubin's presence can also be seen because of the elevated levels of subarachnoid hemorrhages. And the neurotransmitters like serotonin and dopamine are also seen to be a very low extent. The collection of CSF is by lumbar puncture. The subarachnoid space in the lumbar region of spine is like a puncture to collect it. And ventricular puncture, what we do is that we directly into the cerebral ventricle. And the cisternal puncture we are doing is needle inserted into the cisternal magna space near the base of the skull. Then of the Ommaya reservoir placement means small device surgically inserted beneath the skull with a catheter leading to ventricles for continuous collection of these CSF, and external lumbar vein, that is catheter inserted into the lumbar region and connected to external drainage system. The analysis of CSF normally goes like like initially the cell counts, the WBC, RBC, and the biochemical analysis for protein, glucose, and other biochemical markers. And then later, serum albumin index also is also studied. And in the case of, you can see in this table over here, the normal, the bacterial, the viral infections, and any other subperitoneal hemorrhage and what happens. What happens here in the is being shown in these tables. The storage is CSF, once we have collected it, should be like in sterile containers, and it should be under temperature 8 degrees Celsius. It should be avoid freezing if you have to analyze it. The immediate transport if necessary, and insulated containers to protect the sample from light to prevent degradation is required. Then minimize mechanical agitation to prevent any hemolysis. If at all any blood cells are present in that, the hemolysis will further make the CSF not suitable for any analysis. So use cool packs or a refrigerated transport system to maintain the required temperature during the transit. And functions of CSF normally is its protection of the brain and spinal cord. It gives buoyancy and excretion of waste products, then endocrine medium for the brain, and transport by meaning that endocrine medium means it transport hormones across the brain to other areas of the body. Thank you.